back, everybody. Welcome to our weekly physician interview series for Lead Physician, an online platform that empowers physicians to really find their true passion and purpose and live it with prosperity and happiness. I have today Dr. Sophia Apple, a very special guest who's going to share with you a very interesting book that she's written. She was the interim chair and professor for a national cancer center. And she is currently a part-time pathologist and a writer, a new writer in her career, in her life. And she's also Professor Emeritus at the UCLA David Geffen Medical Center. Welcome, Sophia.
Thank you for having me.
I'm so excited to have you. I want everyone to know that I got this book from Sophia. It's called COVID-19, a gripping novel inspired by real events. And I told Sophia, you know what, when I have the chance and after I take my son to college, let me get back to you on reading this book. But I just so happen to have read just the intro on Amazon. You know, you get a free sample. And I could not stop reading this book. And I looked forward to the moment that I had free time and I would read the book. And I've already read the book and I'm still haven't taken, my son's still here. And I read the whole book. And that, to me, that just means so much. Sophia, you tell us why this book? Why is this your first book? You should have been writing books before. You're an amazing writer. What is the purpose of this book that we're talking about today?
So what compelled me to write COVID-19 now is
Yeah.
that I was watching some of the national evening news and I was captivated by video over Hart Island in New York. And I couldn't believe it's a reality. So it's a mass grave site where the unclaimed bodies are buried. And it's true story, Hart Island, you can look it up in the Google. And I began to research this site and felt that our lives are so futile. And I imagined myself being one of that body buried and thrown into that trench. And I realized death is as true as life. And we are really short-term residents in this earth. And it's actually very natural to ask God in the midst of the suffering in the pandemic time. And then God began to input these vivid pictures in my head every day. So I had to really write about this scene that he was providing it to me. And I wanted to publish this book as quickly as possible. So there you are, COVID-19.
Wow. I'm fascinated that you put facts in there as well as a storyline, a fiction, a very gripping story of physicians in the front lines, pathologists, because you're a pathologist.
Yes.
And talking about how they had to deal with the enormous mounting bodies that they hadn't to deal with before. I think it's just, could you tell us how much of it is fiction and how much of it's fact?
Yes, the novel is a fictional novel based on actual events. So for example, Hart Island is true. Yep. Wuhan Institute of Virology is true. Cruise line challenges and identity of virus and kinds of vaccine in development are all true. All characters are fictional, and events of transporting virus is not fiction, not true story.
Yeah, I was going to ask you about that.
But many of them are based on true facts.
That's incredible. So the reason why I wanted to bring you on, Sophia, and thank you so much for being here, is that you're a physician leader, okay? And you wrote this incredible book for the first time in your life. And there is a lot of emotional intelligence in here too. Not only is it storyline, not only is it about COVID, not only is it about showing what the frontline workers have been doing, but you're talking about biases and blind spots. And from an Asian American, from a Korean's perspective, you talk about, the main character is half Asian. Her mother's full Korean. She was stuck on the ship and she had to deal with a lot of attacks based on the fact that they thought she was the one who brought the virus to the ship. And then the Malaysian cruise ship worker who ended up saving her life, and then she ended up saving after that. What exactly? Why did you draw in all of these Asian biases and blind spots? Is there something personal or some story you want to portray to the reader?
Yes, currently many Asian people are getting blamed for this virus. This pandemic actually started as you know, Wuhan, China. And calling it China virus seems to be at first innocent, but deep down it is not. It's it has the blaming tone. Once the blame is justified and accepted by the most people, then the violence is a natural next step toward Asian and Asian American and Chinese American. We face this tremendous inconvenience due to virus. Even some people are dead due to this virus. So it is our natural tendency to shift the blame. But what about this blame? Once you blame, then what's the point of blaming? It serves nothing. It serves not absolutely nothing. And we can talk about coronavirus at this time in 2020, but what about poliovirus which I was infected with? And it started in 1894, and we first surfaced in 1913, which affected our even American US President Franklin Roosevelt. And myself, I had the same virus. But I do not blame America for this virus. And what's the point, first of all, to blame? And all people, regardless of race, are accepted and loved by God. And we need to be loved and accepted by each other. And we have no rights to condone Asian American people and Chinese people. Virus is inevitable.
That's right. And you know what? Thank you for bringing that. I personally have seen people affected by this. My mom, some of my colleagues, and so I wanted to know: what have you seen in California in terms of it affecting Asians?
So California is an amazing place to live because not only we have a very amazing weather and sunshine all the time, so depression should be less than, let's say, Missouri. But what I wanted to say is 1/3 or even 25% of the population are Asian American. And it's very comfortable to live here because of that. But even though we have so many Asian families, people are still not really treating, because it's what they call China virus, all Asian look alike. They can't tell whether you're Chinese or Japanese or Korean. So they targeted people are women, Asian women. So, they kick them and they, literally abuse verbally. And this is happening in California. It's amazing. And many of us are doctors and we're treating these COVID-19 affected patients in the emergency room, emergency department. But the patient themselves saying, "Don't touch me, you Chinese," that kind of very derogatory, negative comments are not welcome.
Yep. And
Yeah.
you know what? In Asian culture, I'm Korean as well, and being brought up in a manner that where we're not supposed to confront people like that or be outwardly when it comes to injustice. It's hard. It's hard to. We don't see much in the news about it. I mean, either me here and there, but it's really not out there. So I really thank you for bringing that up and bringing that kind of awareness to people. And also you even talk about how pathologists, you'll dissect, and I don't want to gross anyone out who's not a physician, but when you're dissecting and you're getting into the insides of somebody, we're all the same. I
Yes,
love that you say that.
yes, I did many autopsies during my pathology training, and beneath the surface of our skin, everything looks the same. We're human beings. Black corpses have exactly the same organs because they're human. But the magnitude of racial bias that Black corpse had to bear throughout his life have been enormously different just because of his skin color. This is unconscionable because I believe God must feel the same. God enjoys variety, and you know that one snowflake is not never same as another, which is amazing. He enjoys variety, and he is a creator who is creative. So he created all different kinds of people, and we should enjoy our differences and variety. But because of skin color, some people have more privilege than others, and they don't even know it. And it just doesn't simply make sense to me.
I mean, that makes so much sense to me now, the way you say that. So thank you for bringing that too. Sophia, do you mind me asking, you mentioned you had the polio virus, and I see you as such an amazing leader, and you know, you are talking about social awareness and equal rights, and you're talking about emotional intelligence, and you're writing this book. How did you get to be the way you are? And how has polio affected you? And what have you learned from it, from having this disease?
Yes, I grew up in Korea and I came to US when I was 13 years old. And in Korea, if you have anything different, especially the physical handicap, you were taught to not to appear in public, and you were taught to suffer alone. And it's not empowering situation. So you have two choices, really. Actually, I had two choices. One is to shrivel and die.
Yeah.
The other is overcome and become someone that I want to become. So I really had no other choice except to do the latter. And I'm very glad I did that. So you don't look at the environment or circumstances, but you listen to the inner voice that tells you, I am someone if I want to be someone. So you're not a victim. You don't have a victim mentality. And all this circumferential evidence shows you that you should shrivel and die. But you have to overcome that. So I did that, and I wanted to become a doctor. I always wanted to treat people and be helpful to people. So I did that.
How did you get the strength to do all that, Sophia?
It was very difficult going through medical school, going through OR, standing 24/7, 24 hours retracting. We've always done that.
No, I meant, first of all, what handicap do you have from polio, if at all? You can stand.
Yes. So fortunately, it affected most of my right leg. So I have a left leg that's strong.
Okay.
But as I age, I tend to fall down more easily, and I'm becoming weaker. So many times, half the times I use a wheelchair, and half the time, if I try to at least try to strengthen my legs, so I walk half the time. But as I get older, let's say 70, 80 years old, I probably have to use a wheelchair full time.
Right. You're a ways from that, but Sophia, I wanted to, so what I meant to say is, how did you have the mental strength to fight all that people were telling you when you were a child? Probably when you were in Korea, they told you to hide, right? You said, and that maybe they told you that you couldn't do it and you can't amount to where you are now. I'm sure people are surprised, but where did you did you get it from your parents? Did you get that from religion? Did you get that from a mentor?
I got it from God telling me who I am by He's defining who I am.
Okay.
And He's telling me that I'm important, that He loves me, He delights in me, He delights in creating me. I hear that I'm an ambassador to the world. I have something to say with my skin, and I decided to hear that voice only and not the negative part.
I love that.
Yeah, because you're this and that, you cannot do this. So the limit is set by yourself. So
Yeah,
I decided to have unlimited, sky is the limit type of mentality, and which is very hard to do.
it is very hard to do, but I mean, you're proving that it can be done. And you are inspiring, and you are a great role model for people. If you have a disability, if you have something that is, the disability might be just on your mind. It might not be a physical disability, but
Yes.
that we all have great potential. And I love that. Thank you so much. What is your next step then, Sophia? Can you share with us? This is an ebook that you wrote, and it's called COVID-19.
Mm-hmm.
Um, Tell us, what is your goal with this book? I could see it as a movie. I think you should publish it like with real books. So what do you want to do with it? And also I would love to see a sequel to it because it was a very moving story.
Thank you. First of all, before I answer that, I'd like to make sure that I say this. I am donating 100% proceed to the food bank in Los Angeles, and
Wow.
Johnny and Friends Wheel for the World program that provides personally fit wheelchair to the world. So because I have my own disability similar to that, I am very passionate about having a mobility, and food is a fundamental need for all human beings. And without mobility to handicapped people, life can be very difficult. So I want to provide a hope to that.
Wait, how do people buy this book? Can you just I think I bought it on Amazon on Kindle.
Yes. So just go to Amazon ebook and type my name, Sophia Apple, and you will see COVID-19 come up. And it's not that expensive, so I hope you buy and enjoy the book. And yeah, to answer the question, I would love to make this book as a printed version in many different languages, and eventually make a cinematography like a movie. That would be wonderful. And my future plan is to write possible sequel to this book. Pandemic is not over yet, so I don't know what happens. So I want to stick to the true story, true event. And I also want to write many other books to manifest to how female physician leadership like ourselves are, what are some of the challenges and how can we overcome and revive and rewrite 19 Amendment in our history. We can be a leader. Right now, men are 95%, 98% are male leaders, but we need to change that. And I like to write about that story.
Great. Oh my gosh. We have more to talk about, Sophia, later off camera. So where can people reach out to you other than, read your book?
Yeah, I'm a shy person, but I decided to be out there in social media. So
Thank you.
you can reach me in two ways. One is unseendoctor@gmail.com. Unseen doctor is because pathologists are mostly unseen, but we are doctors.
Oh, okay. Yes.
It's unseendoctor@gmail.com. And I have a blog that you can search me. It's called drsophiaonline.com.
Wow. Thank you so much for being on this show with me. Thank you for the frontline workers who have saved so many lives and also helped deal with these fragile, poor patients who passed from COVID-19. I can't even imagine the life of a pathologist. I mean, this opened my eyes to it, Sophia. Thank you so much. And if you are interested in sharing your story, please reach out to me at info@drlcco.com. And if you're interested in some leadership training, and I love these stories. We're sharing emotional intelligence right now in my leadership course. Check us out at leadphysician.org. Thank you, Sophia.
Thank you for having me, and you're doing significant and important work. So please, I cheer you up, and thank you for being there.
All right. Thank you so much, Sophia. Goodbye.
Thank you.